The title of my talk today is Your Mirror Your Enemy? And we're going to talk today about the aging face, and we're going to learn about the latest cosmetic facial procedures that can be done to help you. I have a no gimmick rule here. Everything that I'm going to talk about I think is tried and true, and I think very effective. And those are the procedures that I like to do. We're going to start with talking about the aging face. We're going to start with talking about what happens to the face as we age and what we can do to improve that situation. So it's been shown for centuries and centuries ago, I think even the ancient Greeks measured the distances of the different aspects of the face. And in a youthful face, the distances are equal between the forehead, the midface, and the lower face are all exactly the same length. And yet with age, there's changes in those proportions. So if you look at any glamour magazine, any model, any actress, you will see that there's an equal distance for those three areas, and yet as we age, the hairline recedes, the forehead and the eyebrows come down, and the forehead lengthens. The midface also lengthens, the nose grows with every year that we live, and the cheeks descend. So the midface continues to grow in proportion, all at the expense of the lower face, which loses volume because of bone resorption, and a lot of the tissues go from the chin and the cheek and descend into the neck. So we're going to talk about all three areas and how we try to restore a youthful proportion to these three areas. So we're going to start talking about eyebrows and the art of the arch. I learned long ago that modification of the eyebrow is the very earliest thing that young females do to alter their appearance. And even though what's considered to be an attractive eyebrow has changed over the years, and maybe not everyone considered Greta Garbo's very, very high arched eyebrows in the 1930s to be attractive today, nevertheless, a youthful, attractive female has high arched brows, usually sloping outward to the temporal third where it reaches its greatest arch. And yet there are gender differences. Men can get by with lower eyebrows. It's considered rugged, it's considered attractive, it's considered masculine to have lower eyebrows, but as long as you don't have skin on the upper eyelids, as long as you don't have a lot of creases in your forehead, then that's considered to be attractive. And as we can see, males take care for their eyebrows as well. So this is a gentleman who came to me, probably only because his wife insisted that he come, because she didn't feel safe when he was driving anymore, because his upper eyelids were interfering with his vision. And I said to him, yes, we can do surgery on your upper eyelids, but your forehead and your eyebrows have come down. And so unconsciously, the brain is causing the brows to try to elevate, to try to lift the skin off of the eyes so that he could see. So that causes the deep furrows in his forehead, horizontal and vertical, and makes him look angry. And I said, you really ought to consider having a forehead lift at the same time, because the forehead, the upper eyelids are connected, and that you would look much, much better, less angry if you considered a forehead lift. So I tell all of my patients that the purpose of a forehead lift is not to bring your eyebrows sky high and make you look like the Joker in the old Batman series. It's rather to gently and naturally lift the brows a little bit and to relieve the deep creases that are in the forehead. And of course, there's a little bit different goal in a female, because in a female we truly are going for a little bit more arch and a little bit more elevation. So, so if you look before on the left, you'll see that she has skin on the upper eyelids, she has low-lying brows, and she has the deep creases in the forehead, and how much better she looks after the forehead procedure. Some people call a forehead lift an upper facelift. I don't really like that term, but you can see what a tremendous difference a forehead lift can make in terms of improving a person's appearance. Now again, this is the second male that I'm showing. That's not a coincidence, because of all the procedures, men have eyelid surgery and they have forehead lifts, almost in equal numbers to women. That's not true of other procedures. So lots and lots of men are having this procedure done, and you can see what an improvement it makes in his overall appearance and in facial rejuvenation with a forehead lift procedure. Here's, again, another male. And here he is on the lower left, and you can see he's got skin on his upper eyelids. You can see that his eyebrows don't look so droopy because his forehead is contracting all the time to try to elevate his brows. Not that he's ever aware of it, it's just something that happens. So he elected to proceed with a forehead lift, a small incision forehead lift, and his post-operative view is on the right side of the slide. And how much better he looks, more alert, and relief of the crinkling of the forehead and smoothing of the forehead creases. The reason I showed the middle slide is that obviously for women it's not really an issue most of the time, but for men, some men are balding, and I like to refer to them as follicularly challenged, like myself. So I use 5 small incisions. Each one is a 1/2 inch to 3/4 of an inch in size. 2 of them are in the temples where even follicularly challenged males like myself have hair. But in the frontal area, those 3 incisions heal extremely well, even in a balding male, such as this gentleman. So even though you're looking directly at those incisions, you really can't see them. So that's my way to do a forehead lift. There are other ways to do it, but this is the procedure of choice, I think.